in West Texas asks that in the Midland, Odessa area, there are a couple of hospitals designated as vaccination hubs that are going to be adopting the CDC's recommendation for phase 1C by distributing vaccine more broadly. I know we had a conversation with the hospitals out there, and that's not something they're planning to do now. We kind of reiterated that with them. And I don't know if there's anything else you'd want to add to that.
No, Chris, you're right on point. Conversations were had with some of the hospitals out there, and everyone is clear and agrees to stay by the state of Texas eligibility guidelines for 1A and 1B.
Evani Patino, at Channel 10 in Amarillo asked if there are any updates to the distribution to rural areas or the Panhandle, any changes or possible new hubs in those areas.
So at this point, the expert vaccine allocation panel has recommended not to name any new hubs for now. And with increasing supply coming along each and every week, we have been able to make reoccurring allocations to some providers that are not hubs. So that's one thing that you'll start noticing across the state is that we are pushing more consistent vaccine across, and in particular to some rural counties, even without that hub designation.
Got it. Those are the questions I see today. One more has just popped up. Avery Perot, back out of the Big Bend Sentinel, asks whether the vaccine allocation panel is taking into account disproportionate deaths among certain populations or counties when making its allocation decisions.
So when we look at the cases and the death rate at, each and every week, the biggest piece that we look at is how does that play into the vaccine allocation distribution? And ultimately, the amount of vaccine that we have really can either give us greater flexibility in being able to address some of those ongoing outbreaks, or other times because the vaccine may be fairly limited given what our commitments are, we may not be able to increase allocations from a week-to-week basis.
One from Ashley Lopez at KUT in Austin. How could the possible addition of other vaccines besides Pfizer and Moderna into the supply chain affect the state's overall distribution plans?
So obviously, the more vaccines that we have, the better. And the more brands and the more options that we have always adds to our efforts all across the state. Now, with the Johnson & Johnson potentially being approved later this weekend, ultimately, we will see what populations are recommended from both the Food and Drug Administration as well as the CDC's Advisory Committee on Immunization Practices. And as those recommendations come out, those will help guide how we may potentially distribute the Johnson & Johnson vaccine.
Great. Thank you very much. Imelda, that was the last question we had in the queue at the moment. So appreciate everybody being with us. If you have anything else, there were a couple of follow-ups. We'll follow back with people on, but feel free to reach out to us at pressofficer@dshs.texas.gov. That is, I think we've got time to take, we had a couple more pop up. Let's go ahead and take those. We do have a few more minutes left before we have to cut things off. Question from Ashley Soriano at KGNS. What is DSHS or the EVAP view on cities partnering with third-party companies like Curative to assist with administering vaccines?
So ultimately, we leave those decisions up to the local officials and the best way for them to be able to administer the vaccine in their communities. Our main point is that we are providing the allocation to those counties to serve their constituents. How they operationalize that is up to them.
And finally, for Valerie Gonzalez at the Monitor, will the 7-day delays caused by the weather last week mean the next allocation will be delayed to allow providers to catch up?
No, we still plan on pushing out week 12 allocations on time. What we've asked, and some of the providers have told us where they may not be able to handle the additional vaccine. Some of them have declined or told us that they don't want to receive any additional vaccine that coming week. And so we are honoring their request, but we will be proceeding with this next week's allocation on time.
Once again, thank you, Imelda Garcia, for being with us today. Thank you all for your questions and your attention during this briefing. We'll be back in touch with plans for our next briefing. Continue to do these on a regular basis. Again, hope everybody has weathered the storm last week and getting back to enjoying the nice, more typical February Texas weather out there. Thanks, everybody. Have a great rest of the week.